Okay, I'm not used to speaking into a mic, but my name is Steve McSwiggan. I'm a nurse. I've been a nurse for about 27 years. I know it's hard to believe, looking at it, but I've been around for quite a while. And I have to say, I've no experience before this, but just about this time last year of Ebola. So I'm no expert on it, but I've developed a little bit of expertise over the last year or so. My background is in designing and running clinical trials. I've done that for about the last 15 years. And what I'm going to do in the next half hour or so isn't really give you a lecture on Ebola, but just touch on a few, put a background to it and give an explanation of how I ended up working in an Ebola treatment unit in Liberia, and also touch on some of the experiences I've had, and then hopefully answer any questions. So is that really what everybody's signed up for this evening? Okay, right, we're on the right track. Ebola is nothing new, but about this time last year, I think most of us would have been aware of an emerging global health problem that was happening around. There was a lot of media attention around about last September, October in particular. But Ebola is not a new disease. It's been around since about, first discovered in 1976. And it's named after a river in the Democratic Republic of Congo. It's easier to say that than you think. And it's it was a viral disease that was unknown prior to that. It was discovered that it was being passed on by contaminated needles in a clinic there, and there was since then there's been about 25 outbreaks of this viral illness. I'm going to touch a little bit on the symptoms and how we diagnose it shortly. But in those 25 years, if you think about it, there's been about 1,500 individuals that have been infected with the disease, and of that 1,500, just over 1,000 have died. And these 25 outbreaks, the largest one was about 300 or 400 patients. So this current outbreak, which is, we'll touch on, is about 28,000 patients, is unprecedented up until now. So the obvious question is, how did it start? How's it spread? It's spread by, oops, okay, get back to this. It's spread by thing called a fruit bat. There's a very interesting story where it has been traced back, this current outbreak in a province in Guinea, to a child, a 2-year-old child, who I think was playing in a tree. Sorry, he was playing in a tree where bats were roosting, and he may have got the virus through cuts in the skin. And he became ill and died. His brother, his sister died, and his mother and gran also died within about the space. So this was about December 2013, so just about 18 or 19 months ago. They were cared for by a local nurse who became ill, and the village midwife also became ill. And they attended a local hospital, and with that the disease spread. So these are patients that are presenting with a non-specific illness, a fever, high temperature, and vomiting and diarrhea. And this isn't an area where malaria is endemic, so there's a lot of confusion. It's not something that would immediately come to mind as the initial cause of it. But very soon, by about February and March 2014, it became very clear that there was a large problem in this area.